a very large organization, and that leadership throughout is really key. So Desiree will be leading a work group to develop an evaluation plan program specifically for the overall blueprint, not just the individual projects. And that reflects an ongoing commitment. Just Dr. Wilson described, there'll be an annual update, and I think Desiree mentioned this. We intend on having an annual update as well, but it actually is moving throughout the year in various iterations as the environment changes, as we find out ways of being able to do better care through new models of care and things of that sort. So I want to thank, Dr. Wilson very much, not only for this opportunity to present on the webinar with my colleague Desiree Backman, but her leadership at AHRQ. A national quality strategy has really been an important effort. We think guidance towards better health, better outcomes, at a more efficient delivery and a more efficient delivery system. So, with that, I turn it back over to our moderator, Ann Gordon. Ann.
Thanks so much. This was a lot of really great information. And as we're heading into kind of the final part of the presentation here, I want to hand it back over to Dr. Wilson. Next slide. To tell a bit about how perhaps your state or your organization or whatever group it is that you're affiliated with can feel alignment to the National Quality Strategy. Dr. Wilson?
Thanks, Ann. I'd say that there are many ways to align. It may be across all of the priorities. It may be a focus on a particular priority. But, in general, what we see is that you really can look at the three aims and the priorities themselves and see where you have initiatives that might relate. So it's really thinking about what you're doing in terms of person-centered care. How are you engaging people in directly with you, for example, or what is it that you're doing in patient safety? I think one of the areas, and there was a bit of a question that came up about this. One of the areas is, well, what if what I'm doing doesn't match exactly? And I think that the priorities are broad enough that you can really think through and tailor them to meet the needs of the populations that you're really serving. I think that the slide sort of speaks for itself, and I'm going to turn it back over to Ann.
Thank you. All right. So just to finish up the presentation here, I'd like to make sure that you know where to get more information. So next slide, please. So when you find National Quality Strategy tools and resources, well, the website is usually the best place to go. There you can find the 2013 Annual Progress Report along with the reports from years past. We also have a stakeholder toolkit and briefing slides if you're interested in promoting the National Quality Strategy at the local, state, regional, national level, however it is that it fits into your particular conversation around healthcare quality. We also have a set of briefing slides there because we know that the aims, the priorities, the icons, like all of the different content around the National Quality Strategy can be, difficult to pull from lots of places. So we put it all in one place for you, available there through that link. We also have available something called Priorities in Action. Once a month, we like to post a brief summary of examples from around the country that are aligning to the priorities, and we point out which priorities they are, and you can see it on our website. And if you have a suggestion for one, if you have any questions, Wilson has been very gracious to make her email address available to everyone on the webinar, so you may reach out to her if you so choose. Next slide, please. And of course, from our folks from California today who did such a great job. Thank you so much for presenting. They wanted to provide some tools and resources for you as well. We did see a couple of questions, I think, come in from the audience about some of this content and this material. And so here are the links for that, so you're able to access that and do a little bit more research in your time about what California is up to improve health care. All right, next slide. We go to the time of the presentation to answer some questions that have been coming in through the Q&A box. Thank you for sending those to us. I think the first one is for Dr. Wilson, and I encourage our presenters to, talk to each other and answer these collectively as you see fit. But one, Nancy, Dr. Wilson, is actually around the participation of the rest of the Health and Human Services. What information is available about different agencies' specific plans for healthcare quality, and can people find those online as well?
Yes, what a great question. Yes, one of the requirements of the Affordable Care Act, along with the National Quality Strategy and annual updates, is each of the agencies inside HHS to identify what they're doing to support the National Quality Strategy. And those agency-specific plans are all available on the Working for Quality website. So you can download what SAMHSA is doing. You can download what CMS is doing. I will say that each year the agency-specific plans become more robust, and I think this coming year is one in particular where it'd be very exciting to see how agencies are addressing all of the priorities. But you can access those on our Working for Quality website, and they're updated every year.
Great, thank you. The next one is also for Dr. Wilson. One of the questions that we received from an audience member is around provisions or focus placed on making unidentifiable health data available publicly to allow for increased analysis to improve quality, reduce costs, or increase consumer empowerment. That's a long question. Let me know if you repeat it.
I'm fine. It's a good question, and I think there is a lot of activity around the country, both in peering information through the use of registries, to learn more about how to improve quality for particular populations of patients. That's not getting public yet, although we've been working with a number of folks who have registries and work the issues to allow more and more of that information to be public. CMS has also providing access to healthcare data that in an unprecedented way, I have to say, and that really was because of authority that was granted through the Affordable Care Act. So qualifying entities that participate in the Medicare Data Sharing for Performance Measurement Program are now eligible to receive previously restricted Medicare data to measure provider performance. And there's the first 7 organizations from across the country have already been selected, and they primarily include regional nonprofit organizations that are trying to create public websites to share information. So examples are the Minnesota Measurement Community, the Wisconsin Collaborative. I think publicly available information has developed most robustly is through the consensus engine of multi-stakeholders coming together and agreeing to share that kind of information with the